Welcome back. Well, today we got an insight into how decisions were being made at the very top of government during the COVID pandemic. Thousands of WhatsApp messages sent between Matt Hancock and his staff were leaked to the Daily Telegraph. Amongst several allegations, they appear to show the former Health Secretary rejected advice for anyone going into care homes in England to be tested for COVID. Well, joining me now to discuss this further is Chair of the Independent Care Group, Mike Padgham, Dr. Barrett Pankania, a Senior Clinical Lecturer at the University of Essex and the Editor of The Spectator, Fraser Nelson. A very warm welcome to the three of you. Thanks so much for joining us tonight. I'll start with you, if I may, Mike Padgham. You're Chair of the Independent Care Group, which of course represents independent care providers. Now, Matt Hancock, as we've said, disputes this version of events that he watered down Chris Whitty's advice on testing in care homes to just testing those residents who were returning from hospital. What difference, as you understand it, did that make in care homes at the time, that policy?
Good evening, Sally. Well, it would have made a tremendous difference if we'd been able to test people coming to homes from the community, because in our view, if it was thought testing from hospitals was essential, then to my mind, it was essential in care homes as well. And I believe one of the issues was there weren't enough tests. But my understanding was it was short at the beginning, but just a few weeks after, there were plenty of tests. And it just shows to me, if this proves to be accurate, that in fact, care homes were not at the top of the list for testing at all.
Well, that's very interesting. Dr. Pankania, can you comment on this? A spokesperson for Matt Hancock has said the reason that testing wasn't more widespread was because it simply wouldn't have been deliverable at the time, back in April 2020. Was that the case? Were there just not enough tests?
No, they didn't have the capacity, but they also didn't have the will, or they didn't consider this serious enough. Now, remember, we knew that SARS-CoV-2 disproportionately affects elderly, vulnerable people more so. So that group of people should have been specifically targeted to be tested and protected. So if you're protecting anyone, protect the really elderly, vulnerable people and make all means available to not only test, but to test again and make sure that infection is not introduced into that care home setting. A care home is not a hospital. Once an infection enters a care home, it tends to spread, and it spread and it did what it did. So we should have had special measures for the care homes because they're looking after A, vulnerable people, and B, they're not clinical settings, they're not hospitals.
Fraser Nelson, what do these WhatsApp messages tell you about Matt Hancock's role during the pandemic?
Well, it's not so much Matt Hancock's role, it's what they tell us about the way in which decisions were made. At the time, we were told pretty much all major decisions were following the science, the best scientific advice. But time and time again, we see from the Telegraph's revelations that they were pretty shoddily discussed. I mean, the phrase Matt Hancock uses to say he doesn't want to test all coming into care homes is that it would muddy the waters. That's his phrase. Now, why does he think that? It's not quite clear. And there are literally dozens, perhaps scores of examples of other medical advice, pretty significant, from whether children should wear masks, for example. That was explained to the public and following scientific and medical advice. We know from the Telegraph's disclosure it was no such thing. It was a political decision not to let Nicola Sturgeon get ahead of them in something they thought they'd have to lose their political argument on. So what we learned from the Telegraph's disclosures is the methods, pretty shoddy methods, that were being used to decide what was happening to millions upon millions of people.
Yeah, Dr. Pankania, I can see you nodding in agreement there. What did you make? I mean, we don't have the full context of all of these messages. We just have what has been reported in the Telegraph. But it is very interesting, isn't it, that significant health policy was being decided on WhatsApp rather than in a meeting room and perhaps given more considered thought.
Indeed, and not only that, but as you say, they were making policy on the hoof. And if you look at what you needed to do, how fast you had to act, and observe what we had to do and what we did, we ended up with lockdowns, We ended up with extended lockdowns. We ended up with more and more ill patients admitted to hospitals. Whereas what was required was early, fast, decisive actions. And if you had taken those early, fast, decisive actions, you would have had fewer lockdowns, shorter lockdowns, and fewer lives lost.
And Mike Padgham, this protective ring that was put around care homes, was that as bulletproof as we were led to believe?
No, I don't think it was at all. And it's shocking when I look back now and remember that phrase he used over and over again. We were second in the queue behind the NHS. And as you know, at the very beginning, the advice from government was, in fact, care homes not to worry because this virus won't affect you. And myself and others locked down much earlier because we could see what was coming when we saw what was happening in care homes in Europe. The most difficult bit, of course, was that the community transmission and the testing didn't happen until August. So we had several months where people were tested coming from hospital, and that didn't happen in the beginning either, really. So it resulted, unfortunately, in more deaths than was necessary, and I'm really sad about it. And I would just like that. I hope we could learn something from this. The problem with the public inquiry is, which is I welcome this coming out today, is we need to learn lessons today. We can't be waiting years to find out because we need to prepare ourselves perhaps for the next pandemic. We need to know what went wrong and put it right for the future. And I'm glad this has come out now. And I hope the government will take action quicker on protecting social care in the future.
Fraser Nelson, a teacher whose mother died in a care home that had just 3 tests for 100 people has told Sky News today that she would like to see Matt Hancock give back his I'm a Celebrity fee and have his book taken off the shelves. Do you think his post-pandemic celebrity is backfiring?
I'm not quite sure if this is in any way part of Matt Hancock's plan. He didn't want these messages to become public. It doesn't suit anybody. And the Tories are almost hoping that the COVID inquiry will kick this into the long grass, so nobody discusses this until after the next general election. And while it's true that something like a quarter of all COVID deaths happened in care homes in Britain, there were similar proportions right around Europe. So this was a mistake, which wasn't just made in Britain, it was made right over the continent. Now, that doesn't make it any worse, but it does show that that there was the problem goes way beyond what Matt Hancock was or wasn't saying at the time. I do completely agree, though, that we can't wait for the inquiry to come up because we could get a new pathogen any moment, and when it does happen, we're thrown back in the same apparatus which demonstrably failed last time around. So the longer it takes to actually look carefully at what's happened, to have these very difficult discussions about what went wrong, and the longer it's going to take to fix it, and the more which the country is exposed to the same sort of mistakes being repeated, because that's what happens if you don't learn from recent history.
Yeah, Dr. Pankania, just on that, as a clinical lecturer and an expert in this field, is it dangerous that this public inquiry hasn't started yet?
Well, we need to know that, and we need to know all the mistakes that were made, and we need to know about it fast so that we don't repeat them. But not only that, emerging infections are coming all the time, and we need not only an inquiry, but we need to set up a steering group which will not be interfered with like it was. Now, if we look at how COBRA meetings had the presence of SPAD, there's Dominic Cummings and all the others who were attending those COBRA meetings, we need to address all those issues as well, because if there is interference with decision-making, you're not going to be making the right decisions.
And Mike Padgham, just paint the picture for us, if you can, about the number of people coming into care homes that weren't coming from hospital and were perhaps bringing COVID with them. Were there a lot of people coming from elsewhere at the time during COVID?
Well, yes, normally you can get admissions on a short-term basis from the community, but I think one of the issues was that, as Hancock indicated, the staff are in the community. The staff played a factor in that as well, and we weren't testing staff at the very beginning as well, so that was a tough issue, but it was very tough at the beginning for everybody. And I don't blame this entirely on this particular government, because social care was a very precarious position before the pandemic came along. So we were very weak and exposed at the beginning.
And Fraser Nelson, I need to ask you about the ethics of what Isabel Oakeshott did. You know, she was entrusted with this material to ghostwrite a book for Matt Hancock, presumably for commercial gain. His spokesperson claims she's broken a legal NDA. Would you have done what she's done?
I think any journalist who was on position of this treasure trove of information and didn't publish it would really have to ask why they're in journalism. The reason the role which journalists can play in society is taking information which ministers don't want to be made public and making it public so people can have this conversation. So the public have got a right to know, and it's typically it's your journalist's job to break stories. Well, and this isn't something which is trivial. This is something which is absolutely fundamental, life or death situation. It's an outrage, but it's not being discussed by the inquiry. And this is where journalism and the Daily Telegraph can step in, make these documents public, and to force government to pay attention to something I'm sure quite a lot of them would rather ignore.
Well, very briefly, if I may, Fraser, in light of that, has Matt Hancock been naive in how he's handled some of these things after the pandemic? For instance, using a journalist like Isabel Oakeshott as his ghostwriter?
Well, I have to say, I'm not quite sure what Matt Hancock thought would happen if he trusted an explosive documentary haul, the likes of which has never been available to journalists or historians before, into the hands of a famously effective investigative journalist. You'll have to ask Matt Hancock, really, why he thought that was going to be within his best interests. But what Isabel Oakeshott has done is certainly within the best interests of the people who have got every right to know the decisions that were behind what happened to millions of people during lockdown and how we can make sure this don't happen again.
OK, Fraser, Nelson, Dr. Pankania and Mike Padgham, I really appreciate your thoughts this evening. Thanks so much for joining us. Thank you.